Are you a high school baseball player dealing with pain or tightness on the front of your shoulder every time you get into layback? I'm going to go over today why a tight pectoralis minor can be contributing to those symptoms. How do I know this? My name is Dr. Jeff Lewis. I'm the owner and physical therapist of Lewis Physical Therapy and Sports Rehab in Point Pleasant, New Jersey, where I've helped countless baseball players get back to throwing pain-free, get stronger, and throw harder. A tight pectoralis minor muscle, and the pec minor for short, is a small muscle on the front of your shoulder. We think of the pec major as the big muscle, the big pec muscle when we're bench pressing, push-ups, anything like that. The pec minor lies directly underneath it, and it attaches to the front of the shoulder blade at a bone culture coracoid process, and then it attaches down underneath the big pec muscle down onto the ribs. The reason this muscle is important to look at, especially at tissue quality, tissue length, and throwers, is because of its attachment to the front of that shoulder blade. If that muscle gets tight, it will have a tendency to take that shoulder blade and tip it forward and rest in this forwardly tipped position. Now, the reason that's a problem is because when you get into layback, if you don't have sufficient mobility throughout your shoulder blade to create that stable position for maximum external rotation occurs due to a tight pec minor, well, what's going to happen is you're going to end up getting stress in other areas in the front of the shoulder. More often than not, that is the bicep tendon, and that's what I see a lot of times for high school baseball players, especially pitchers, that are dealing with pain on the front of their shoulder. So if our examination determines that, hey, there's definitely some tightness throughout that pec minor that's contributing to symptoms, one of the things we want to work on at first is improving mobility through that pec minor and then encouraging some type of active muscle work to get locked into that new position. So first thing we're going to do, all you need here is a lacrosse ball and a foam pad. So when we're finding that pec minor, what I really like to use to give guys for cues is we're going to come to the front of the shoulder here to start. And if you are on the front of the shoulder and you move your finger back and forth over like so, you're going to feel this almost rope-like tendon. That's your bicep. We do not want to have a lacrosse ball on that bicep there, okay? From the bicep, you're going to just gradually move in, and you're going to be on another spot that's a bump, and it's probably not going to be that comfortable for you. That's your coracoid. Then you're going to drop down and in along the length of the pec minor, which is going to be like this length here on my hand. That is where we want to work on getting that lacrosse ball to help with this more than anything. We do not want to be on the coracoid. We do not want to be in the bicep. If you do that, you're probably just going to irritate your symptoms even more because it's naturally just very uncomfortable areas to begin with in guys. So we have the ball here. Again, not on the bicep, not on the coracoid. We're going to be right along here. And I like to start with what I call scanning. So you're really moving along the length of that tissue in the position I'm going to show you here to see, okay, where's it tender, where's it not tender, and that's where you really want to target your treatment. So you're going to go ahead, you're going to lie on your stomach with your arm in that 90-90 position. I have a foam pad here. If you don't have a foam pad, you can use a pillow, something that's going to be propped up off the ground. The ball is going to be on that foam pad. Your arm is going to be out to the side here, and I'm going to be on that lacrosse ball. And again, I'm moving through, finding that spot in that pec minor that's pretty tight, okay? So now let's say right here I find my spot. I'm in the spot there. I'm then going to engage that shoulder blade down and back, and I'm just going to create some external rotation. So I'm doing a little bit of pin and stretch on that pec minor to help improve its mobility into this external rotation layback position. Then I might move to another spot, do the same thing there. You would probably need to do no more than 5 to 10 of these reps at each different angle. I don't want you to sit on here for minute after minute and cause it to be maybe a little bit sore. So we're going to work through that. After we do that, then we're going to go ahead and grab a resistance band, and we're going to work on just locking in that motion that we just helped create from that mobility drill. So you'll take a band like so. You are going to be on a knee. Your arm is going to be out in front. You're going to row back, engage that shoulder blade down and back, and then from here, you're going to flip up into that 90-90. Again, what I don't want is your shoulder forward like this going up. We want to keep that shoulder blade engaged down and back, and thinking about you're almost tucking your shoulder blade back against your rib cage, okay? So we're getting that posterior tilt of that shoulder blade. So we're here, going up and down. You can go through the full range. You can either do isometric holds, which I found for some guys is great because it really forces them to hold that position and then come out of it. There's a lot of different ways that you can go through that. So again, if you're dealing with pain or tightness on the front of your shoulder every time that you go to throw, especially when you get into layback, a thorough examination is crucial. Make sure you get the best insight in terms of what is the painful structure. And in the case where a tight pec minor is involved, these are great drills that you can do in your warm-up or your maintenance routine. So if you have any questions below, go ahead and leave a comment of anything specific to shoulder pain in throwing athletes, and we'll get back to you with a response.